Hello and welcome to TV on TV. I'm State Representative Tommy Vitolo. Today is Thursday, December 19th. You're watching Brookline Interactive Group. We have a great show for you today. Today's guest is the one, the only James Drake. He works over at the Brookline Center, and we're going to talk about all sorts of things that Brookline Center is doing for mental health, for community health, for public health. Really, an unbelievable organization. We're lucky to have them. But first, before we get there, stay tuned. We want to go through the news. The United States government appears to be headed toward a shutdown. A continuing resolution was released late Tuesday night and received backlash from multiple groups of Congress members, including the Freedom Caucus. Speaker Johnson can only lose a handful of Republicans before having to rely on Democrats to pass the CR. The Senate is expected to vote on President Biden's final judicial nomination. The United Nations Special Envoy to Syria has warned that the war has not ended, despite the removal of President Bashar al-Assad by opposition fighters. Massachusetts scored an A rating in gun violence prevention in a report completed by Giffords Law Center. The new regulations passed this year brings the Commonwealth up from 7th place to 5th in Giffords' ranking of gun law strength. Vineyard Wind officials say they have returned to installing turbine blades at the offshore wind farm off Nantucket. This work was paused when a turbine blade broke in July. 2 Massachusetts men were arrested Monday on federal charges related to a drone attack on a U.S. military base in Jordan. The attack killed 3 American service members and injured 40 others. The town of Brookline has agreed to pay a total of $101,000 to employees of the Brookline Fire Department to settle a class action lawsuit regarding unpaid overtime wages. Brookline police are looking for a male caught on camera stealing checks from a Brookline residence and then depositing them in Providence, Rhode Island. An audit done by the United States Postal Service Office of the Inspector General of the Coolidge Corner Post Office found significant problems with the branch. These problems include thousands of delayed pieces of mail, packages scanned as delivered while still in the office, and missing mail keys. Anecdotally, I mailed this postcard in December 2020. It was returned to me as a bad address the day after this Inspector General report was released just a few days ago. So if you've had problems in the Coolidge Corner Theater, you're not crazy. You're not alone. My hope is they resolve those problems in the weeks and months to come. And I will add that much of this effort to identify and repair these problems has been led by our Congressman Jake Auchincloss. Without further ado, I hope that you will stay tuned to TV on TV here on Brookline Interactive Group. We want to cut over to an interview recorded about a week ago with my good friend James Drake over at the Brookline Center. Thanks for watching and do stay tuned. And welcome back to TV on TV, right here on Brookline Interactive Group. Today we have an outstanding guest, one of my favorites, James Drake. He is the Chief of Partnerships at the Brookline Center for Community Mental Health. And frankly, he's a wonderful guy. Thanks for being on the show.
Thanks for having me. Glad we finally get together. This is great.
You know, more often than not, we get together in person. Today, you know, the digital divide is a digital bridge. Hey, look, you know, with all of my guests, it always starts the same. Tell us what you've been doing your whole life.
Absolutely. Great question. So for the viewers, you should know I'm a West Coast kid. I grew up in California. Don't hold that against me. But yeah, so I grew up with me and my mother, large family. And so once I got from my upbringing to college, I actually ventured more east. So I had a pretty strong career. I got my education as a therapist in Idaho, which is interesting. And then I started my career actually working in Florida. And I'm going to take you around the world, but it goes from Florida to Japan. And then I worked in Maryland, between Baltimore and DC in Prince George's County. And then I got recruited up here, and I've been in Massachusetts for the last 4 years. My entire career, I've been a therapist, and then I've also worked as a crisis response director. So doing a lot of that intersection work between the community, mental health, and the hospital sequence. I've worked with military and law enforcement. Interesting enough, so I used to provide all the training for law enforcement in Prince George's County. So that was about 2,600 officers every year. So I was overtraining there. And then because of that work, the Brookline Center, Ian Lang, our CEO, he recruited me up here to work on new projects here, and been happy ever since. So we love it here.
So here is Brookline and here is the center. Tell us, for those who don't know much about it, about what we call the center, the Brookline Center for Community Mental Health. Where is it? What do you all do? Give us some scope. Tell us about the center.
Absolutely. So the Brookline Center, we're located on Garrison. So if you're just coming around from Washington Square, we're right by the Stark Market. Just go up a block and we're right there in the residential area. Easy to find, easy to get to from the T. So we're basically a hybrid organization. So we provide a lot of base mental health services. That includes therapy, that includes groups. We work in schools providing that work. We work in the community providing that work. We provide case management services. We have psychiatric medication services. And then we also have a lot of innovative programs and things too that are both local, regional, state, and in other states as well, that do a lot of specialized services and programs. And we're developing more systems work both locally and across the state on that too, so we can share what we're finding that works, provide training to other organizations, provide consultation and support to other organizations, and to grow out new programs.
So talking at least at first about the services provided at the center at Garrison Road, who are your patients? What are the kinds of people? Where do they live? What sorts of, generally speaking, what sorts of reasons are they coming? How do they find you? Who pays for it? Like, there's a lot going on here. Give us a more.
Absolutely. So I'll keep it general. So we work across stage span. So everything from like 3 years old to 99, I would say. Hyper local, especially in Brookline. So we serve everybody in Brookline. So let me start from the therapy side and then move to the service side. So from a therapy standpoint, most folks can come by either looking at our website or just giving us a phone call. Pretty simple to access us, and then we'll triage you into services. Services are mostly paid for most people by their insurance, and we take every insurance. So there's no insurance that we do not take. So we take insurance, and that's how most folks get access to therapy, clinical services. That's everything from one-on-one therapy to groups to any other specialized clinical program that we have for therapy. So that's how that works. And then we have a number of other services that are community-based services also in Brookline that have partnerships with other organizations in Brookline as well. So that would be case management services, that's resources, that's direct cash assistance programming. That also includes other sources like we have what we call peer support, where you can we don't have official peers, but we have people that work in that kind of capacity. We have programs that offer training to other organizations and other programs and other sites and locations. We have a local Bright program that operates in Brookline High School. That's a tier 3 program. So there's a lot I can share, but to summarize, basically, for the most part, people contact us, they get services that are typically paid by their insurance, or there's some other contract that's paying for the service that makes it free for them.
Now, in addition to providing mental health treatment and support close to home, I know that you all are working outside of town, working much more broadly than that, innovating. And one of the ways in which you do that is through the Innovation Institute. So give us a sense for the Innovation Institute, what you're trying to accomplish, how you're going about it. Tell us about that.
Absolutely. So I'm glad you asked. So the Brookline Centers, we're actually one of the oldest community mental health centers in the country. So we got our start in the 1960s, right after what we call deinstitutionalization happened. So at that time, there were a lot of locations where people got care within a facility, and then they institutionalized those locations, meaning people moved out of those facilities and they got care back in the community. So that's how the Brookline Center came about in that time period. So within that, outside of our base services, we've always been an organization that have developed new programs and new approaches to care. So 2 years ago, we decided to consolidate those programs under one focus area as an innovation institute so that we could extend our work. And this was after many years of talking about how to do this, why some of these programs that I'm going to talk about, they operate locally across the state and in other states. So it made good sense to do so. So we basically have three focuses at this point under our institute. So one we call early psychosis or clinical high risk individuals. So that's a program that tries to get at the first end of treatment for people who might be at the brink of having a psychiatric issue for psychosis potentially. And so it's a program that's early intervention for that. That is a program where we have lots of cross collaboration across the state. We're working with other organizations. We're working with the state itself to provide that kind of service and programming. So that's one of our focus areas, and it has a number of different service lines under it. So it provides direct service for people who might be at risk for psychosis at the early stage. It provides information and consultation to other organizations. It works with other organizations, and it provides resources and contact information across the state for people who just want more information. If they're seeing this in a loved one or a family member, what do they do? Where do they go? What's the process? How do they get support? That kind of thing. So that's one focus, I would say. The other is what we call just school-based programming. And so this is beyond therapy. So we have two programs in that focus now. One's called Bright, and the other is called School Telebehavioral Health. Both of these programs work across the state, and they work, well, and one of them works in other states as well. So Bright is a tier 3 intervention, meaning it's at the most intense level. It's for students and for schools who need professional development for the kids that need the most support. These are kids at the either elementary, middle, or high school level who have stopped attending school for a mental health reason, or they've had a long extended absence. So they're at high risk for not graduating or continuing school. And so this program intervenes at that level. It provides a kind of wraparound model that's strategic and customized for that school. And it targets and looks for those kids who have the most intense issues. And one of the ways we've been able to grow it beyond just the state of Massachusetts is because we've been able to show with good data that at a 90% rate, a lot of these kids who received this program graduate at 90% rate, where without the program, they're graduating somewhere in the 50 percentile range. So it's been extremely important and popular. We're actually in the process of expanding now, moreover, across the state into mostly a lot of the high schools. But in other states, we're in Oregon, we're trying to work in New York. There's other places that we're working in now as well. And then the other program is called School Telebehavioral Health, where we're really working more as like a consultant to schools to help them address their telebehavioral health needs, because there's a workforce issue in mental health. So what that means is everybody knows that mental health is a hot button issue, but unfortunately, it's really hard to have the staffing, have the space, figure out how your program is going to operate, how does it work well with your teachers and your districts. So the School Telebehavioral Health program is really helping to address schools, especially if they're in urban areas or rural areas in the state of Massachusetts, to help them stand up the supports that they need and the programming they need to provide mental health services that are virtual. So it helps address a lot of those issues. So that's a second focus, school-based. And then the third is we're offering a lot of integrated care options. So as you know, the state is, this is not a new program that we created, but we're helping to develop it in a new market. So the state has turned on some codes called collaborative care codes in the state of Massachusetts. It allows you to provide mental health services in a primary care setting. And so if you can notice the trend with all three of these innovations that we're focusing on now, it's allowing us to work in different ways, in different settings, and do different things, which is really a key for mental health. If you're just providing the traditional services, you run into a lot of access problems. You run into a lot of representation problems. It's hard to customize the existing services to the level that you need. So you really need to have updated approaches to how you're doing it. So in this, we've launched over the last year and a half, programs where we're actually implementing and consulting with primary care practices in the region around Brookline and also in Brookline as well, especially in pediatric offices where they see a lot of mental health. There's a lot of data that shows who's going to get hit most with mental health needs as far as kids go. It's going to be your schools, and that's going to be your primary care practices or your pediatricians. They're going to be the ones most overloaded in the community with those needs coming from children. And so it's a great intersection point. So we're providing teams, a team approach and in those locations so that we can get early intervention for people who need it. We can provide support to the practices. We can help update. And it's a new way to be funded for those things that's more sustainable because it bridges both your medical health and your mental health together. So those are the three focus areas that we're starting with our Innovation Institute, with the goal and hope to both build those programs up. We want to also share our knowledge with other organizations, share what we're learning, what's working. We want to provide training and consultation to other organizations and partner with others. And then also, we're going to also remain optimistic. We're going to keep our quality high, both locally in Brookline for the services we already provide as well, and look for new opportunities to do new things because that's what's needed. We're really focused on bringing more mental health to where people are in ways that they'll accept, that fit their fast-paced lives.
And a quick follow-up, I think this is true. Maybe I'm totally out of line here, but in fact, COVID sort of jostled the system to allow for these forms of treatment. Sort of telehealth treatment prior to COVID was very restricted. And then in Massachusetts during COVID, we said, all right, you can do almost anything, not everything. You're not going to operate on somebody over Zoom, right? But a lot of this could be done telehealth. But it was done at a temporary basis. And then in 2002, 2003, we said, you know what? This is working. It's increasing access. It's lowering cost. It's allowing us to bring on health professionals who otherwise might not be able to work in those places, those hours, those conditions. Am I right about this? This is a good thing, right?
Absolutely right. It allows you to break down silos. It allows us specifically at the Brookline Center in Brookline and otherwise to take on a more public health approach. So you're right. COVID forced us abruptly in some ways that we knew we had to, in other ways we weren't quite ready for, but we had to do it anyway to address the needs that were going on. The mental health skyrocketed, as you've known, and you couldn't just have in-person traditional services. So you really needed to branch out. So these approaches as a start are great for us because it allows us to do a couple things. We can integrate with other industries. We can have cross-learning. We offer service, allows you to offer services in more of a hybrid way. So if you need to be co-located, you're co-located. If it needs to be remote, you can be remote. If it needs to be in person, it needs to be in person, which gives you a lot more flexibility to think about how you structure and set these things up. It also made it more necessary for consultation and training and advocacy because you do have to think in this broader way. It also allowed you to think, well, if we're putting the services in new locations, then that also means we need to diversify who are the people who are providing these services, which allows you to address a lot of diversity, equity, inclusion needs in a different way, because certain populations you're trying to serve, whether Black and brown or urban or rural areas, you just don't have the people that might address and be more comfortable for certain populations. So if you can mix your structure, if you can think about how to integrate in different ways, if you can think about different approaches, it actually allows us to potentially try to do more prevention work because you have so many more options that also these are also probably some of the complications too, but it allows you to get further upstream on the problem rather than waiting till somebody has an emergency or they call you for service or they end up in a hospital. You can try to get further upstream where you're thinking more in a multi-tiered approach, whether it's in schools or it's public health. And we're excited about it. It's hard work, but we're excited about it.
Love it. My favorite program that you all have is the Healthy Lives program. So I'm not asking for me, I'm asking for my viewers. Tell us about Healthy Lives.
Yeah, and I gotta say, so yes, let me tell you about Healthy Lives, and then let me tell you why it's so important. And it's actually one of my favorite things. I've been in Massachusetts now for 4 years about Massachusetts. So the Healthy Life programs is similar to that integrated care focus. It's actually a part of that. It's the other program other than collaborative care, but it provides a team approach that's high touch for people who have high medical issues and high level mental health. So, for example, this is a random example. This could be someone who's a person in the community who's in a wheelchair, and they also have a very strong mental health diagnosis. And oftentimes, what we see with people like that, that's one example, is they have a hard time getting to the appointments, navigating the system, which we all have at different levels. But on a really intense level, a person with that level of need leads a lot more intensity, frequency, and high touch nature to the care that they're receiving. And so our team in Healthy Lives is comprised of a nurse, a case manager, and a therapist. So you have a trifecta team where you're able to provide on the spot initial assessments. You can survey health needs. You can do things as simply as say, hey, did you take your medications today? Did you receive them? They can go to the doctor appointment with you to make sure that you're understanding what the doctor is telling you, and they can advocate for you. They can do things where we've had clients who were in a wheelchair, they were a veteran, they hadn't walked in 6 or 7 years, and we joined them with their PT appointments. And over time, we were able to witness them walking for the first time after several years, and just helping them to navigate daily life, get back on their feet, actually fulfill the care that they're actually already receiving and improve it. So that's a Healthy Lives program in essence. And the beauty of it is you helped us get it. So you were the person who helped us advocate with the Senate to secure earmark for it, and it's been fantastic. That program is, in essence, is part of the reason why we were able to include in it and branch off into collaborative care, because we had already had examples of success of doing an integrated model that we could show. So that direct effort that you provided for us has been huge, because that is one of the specific things we could point to and say, we're already working in an integrated way. We can do more. We have a good sense of what works. We have partners. We have support. We just need funding to allow us to do it. And it will benefit everybody. And it's been fantastic.
Well,
So thank you.
as you know, I love it. I'm so grateful for the work you do. And these are folks who have two seemingly separate problems. And if left as separate problems, they struggle with each of them. But when taken on together, you get that synergy. You help both sides together, and people show real improvement. It's wonderful. You talked about partnerships. In just a couple of minutes, tell us about some local partnerships and how you're working with other organizations and thinking through that.
Yeah, so we have a lot of partners, and so that's part of my role. But I'm going to focus on three key partnerships that are ongoing and are really strong. And I'm so just excited about the work that we continue to do. So one, as you know, is that we have a strong partnership with BHA, the Housing Authority for Brookline, which has been fantastic. So in that partnership that we have, we're allowed and able to provide basically case managers at the housing authority themselves. And if for those of you who haven't been there, the housing authorities, there's many buildings, there's lots of locations. In one location or one building, you could have anywhere from 50 to 100 people. And that's not speaking specifically to their housing units, but just the number of people in that area. Or you could have up to close to 1,000. There's lots of people. So what it allows us to do is to actually place people who are case managers in the housing authority themselves, so that they have direct access to the people know them, they can see them. We can work directly with the BHA, we can work directly with the housing managers, and we can do a couple different things. We can get ahead of issues. We can help them provide resources. We can provide direct service to them, or therapy, or connect them to the center for better services so they stay connected. We can also help them with their tenancy preservation. If there's an issue going on and there's a fear that they might move to the eviction, we can get in and intervene and support these folks so they stay housed. They stay housed, you have a much better chance of helping them manage all the other needs that they have. So that's been a fantastic partnership because of that reason, because it gives us a direct connection to the housing authority, and it allows us to both work together and also think ahead about future problems that we might want to work on together. So that's been fantastic. Another one, this has been more recent, and as we continue to work together, we're going to figure out specific ways to really work this out, is actually BCDC. So we work with Brookline Community Development Coalition directly. I'm actually on their board. So that's another way that we have direct tie. And some of the work that BCDC does that's so important is similar to the housing authority, but it's not in the housing authority. So by working with BHA, we get to work with residents who are directly in the housing authority. And by working with BCDC, we get to work with all the residents who are in Brookline who aren't in the housing authority, who have very similar needs. So that also includes case management. That includes how do we work around resources or cash assistance? How do we get them connected to mental health services when they need it? How do we get ahead of any needs that they're having, or advocate for them, or work with them around what's happening in the schools? So that's been fantastic as well. Could say the Brookline Teen Center as well. There's another one, fantastic. And so one of the projects that it's a collaboration between many other Brookline organizations, the health department and the town and the teen center, is we're looking at after school programs. We're looking at how do we work in the teen center building so that we can provide care there. Sometimes we use the teen center to provide, they have a service where they do a lot of the landscaping and gardening. And so we hire them to do that at the Brookline Center. So it's doing these kind of collaborations, but thinking beyond just a normal business contract, and how do we integrate our work together and on both sides so it's easier for the clients to navigate. It rolls off the tongue. You don't have to think about the Rolodex of what somebody can offer, what they can do. You can just call them up or send them over, or somebody's already there. So that's been fantastic. And then I would also just say the health department is specific, because right now they're in the process of rolling out their new strategic plan. After we worked in cross collaboration with them and many other organizations in Brookline about how to address these needs around housing and mental health and access to care and transportation, but do it in a public health way in concert with all the other local organizations. So that's just a few, but it's great. So lots of things are moving.
James, we have 1 minute left. None of this happens without resources. Give us just a taste for where your resources come from, and if any viewers are interested in contributing to that, how they would do that.
Fantastic. So we're a nonprofit. So if you want to donate, you can go to the website. There's a space there where you can donate. All donations are welcome. We would greatly appreciate it, and thank you. It goes far. But basically, we get our funding in 3 different ways. And we don't have enough time to go into detail, but just to overlook, we have a development department, and basically they're doing fundraising and events all year. So we have a Woman at the Center event that we do every year. That's usually in the fall. It just passed. And then getting closer to the summer, we have a youth development fundraising event. We have a gala. So there's actual events. We get runners for the Boston Marathon so that they run and raise funds that way. So those are a couple different ways. Another ways is that we do a lot of philanthropy. So we target a lot of community foundations across Massachusetts. We have our board that contributes a lot as well. And then we have contracts, and those contracts are both state and federal contracts that we go after, as well as contracts that we pursue privately with other partners. So we've had partnerships with all kinds of entities to get that work done. And then lastly, we have insurance and fees. So the billing that we do for our therapy or mental health services brings in funding from insurance. And then sometimes that we get contracts with those insurance companies to do some of these innovative projects, like our early psychosis. We have contracts with Department of Health. We have contracts with Blue Cross Blue Shield. So there's other contracts and ways that we do this. Thanks.
Yeah, so brooklinecenter.org is that website. That's where folks want to go to learn more about your services, to learn how to contribute, to learn how to participate in all these different ways. James Drake, Chief of Partnerships at the Brookline Center for Community Mental Health. We're so grateful for all of the work that you and your colleagues do. And I'm grateful you took some time and came on the show here on Brookline Interactive Group. Thanks for coming by.
Thanks for having me.
And folks, another great episode. We get better and better every week. Brookline Interactive Group, I'm Tommy Vitolo. You've been watching TV on TV. Have yourself another great week. We'll see you soon.